Welkin empowers health organizations to deliver patient-centered care. Welkin is purpose-built specifically for healthcare organizations. Some key differences you'll see from other tools used for patient management are configurability, patient centricity, extensibility, and workflow automation that enables more human caregiving. In this video, we'll focus on Welkin's care delivery portal, where the care team would spend their time. As a member of the care team, I start each day by logging into Welkin's user portal. I land in my inbox, which is a collection of personalized tasks I need to complete today. They keep me focused on what I need to do for my patients, whether I've assigned them for myself or they've come from my team, or automation rules and triggers. They're grouped by categories that are unique to our program, patients, and the type of care we need to deliver. The inbox categories and additional information that is displayed was configured by a program director so that I have an at-a-glance summary that helps me understand what I need to accomplish. One of our program's priorities is preventing patient attrition, so I start by quickly re-engaging patients that haven't been contacted in more than 2 weeks. For example, I see that Darius Jones hasn't had any contact for 20 days, so I click on their name and I'm taken to their profile. All the members of our care team that engage with Darius are centered around this patient profile. It contains information from systems that are integrated with Welkin, like an EHR, assessments the patient fills out, inputted information from other people, and a full history of our interactions with Darius. In the timeline, I can see the last time we contacted Darius was a few weeks ago. I can use one of several channels to communicate with Darius, depending on which channel they are most responsive to. The action bar is fully configurable and extensible, so we can also build additional integrations on top of Welkin, like video chat or a custom action, so I don't have to navigate to another application or web page. This time, I'll send them an SMS text to check in. I can compose a message from scratch, but since I already have a re-engagement template created for me, I'll save some time by selecting it and hit send. Back in the timeline, I'll dismiss this alert so anyone else in our care staff working with Darius knows they don't need to reach out to them. Let's say I don't get a response from Darius after a couple days. Because Darius didn't respond, one of Welkin's automated processes created a task for me to follow up with them on a phone call. Our program director set up this automated process so that our team doesn't have to go through all our patient profiles to find out who hasn't responded and who they need to contact. This also helps us prevent patients from dropping out of our program prematurely and putting their health at risk. I'm going to give Darius a call to start working through the items which are due first. Our program director has created a template for our ongoing call appointment type. This template ensures that best practices are being used across the care team and reminds me what I need to accomplish with this call. I also have the common actions needed for this type of appointment towards the bottom of the prompt. I can take any notes that need to be attached to the visit and schedule a follow-up. While I have Darius on the phone, I fill out a health risk assessment. Based on Darius's responses to our risk assessment, an algorithm updates their risk score that I can see in the sidebar. Welkin's extensibility allows us to automate this update using whatever integration is appropriate. When Darius's risk score is updated, a couple of automated workflows are triggered in Welkin. The first is a new alert, which we can see at the top of his profile. The second is a risk reduction care plan that has been added for Darius. Since Darius told me their PCP is adjusting their medications, I update their care plan to remind our team to check in on these medications in a week. I know that all the relevant information added by other care team members will be visible here on the patient profile, empowering our team to provide truly patient-centered care. Darius's entire care team can now also see the activities we completed, like the new assessment and updated risk score, because they are reflected in Darius's profile. The program director has set up one final automation to help Darius remember that he has an upcoming visit. An SMS is scheduled to go to Darius the day before his appointment. If Darius needs to reschedule or if they reply in any way, our phone tree is set up so that messages come directly to me and is also logged on Darius's profile so they can easily reach me when they need, and the rest of Darius's care team can stay updated. The customized patient profile, automated workflows, and my personalized inbox were created once by our program director in workshop, but they can be reused across the entire care team. As we continue to learn what works best for patients in our programs, We can give that feedback to the program director so they can easily iterate and roll out updates. Over time, we know this will empower us to deliver the best patient experiences and highest standard of care.